Attention Deficit Hyperactivity Disorder, ADHD, is one of the most common psychiatric disorders in children and adolescents. Approximately 7.8% of all school-age children will have been diagnosed with ADHD at some point in their lives. Intuniv is the first selective alpha-2A agonist to be approved for ADHD. While the mechanism of action of Intuniv is not known, preclinical research is beginning to provide insight into the role that the alpha-2A receptor may play in ADHD. To help us understand the complexity behind ADHD, we will look at where the symptoms of ADHD are believed to originate and our current understanding of the manner in which chemical imbalances in the brain are thought to result in the symptoms of this disorder. ADHD is a neurobiological disorder that has been linked to the prefrontal cortex, PFC. Neuroimaging and neuropsychological studies show that dysregulation within three main subregions of the PFC may result in symptoms exhibited by ADHD patients. Each ADHD patient's chemical imbalance within these subregions can be different, which may give insight into why patients diagnosed with ADHD may present with different symptoms or combination of symptoms of this disorder. To understand how alpha-2A receptors may play a key role in ameliorating ADHD symptoms, we will examine new research that takes a closer look at norepinephrine and what is thought to be occurring at the synapse. Preclinical research shows norepinephrine is released into the synapse through an adjacent axon, facilitating the flow of information along the cortical network. It is believed that the alpha-2A receptor acts as a gating mechanism, regulating the strength of the information flow. When alpha-2A receptors are unengaged, ion channels are open, and the signal which carries information is weakened. Engaging the alpha-2A receptors closes these channels, connects the network, and strengthens the signal that carries the information. This research builds on our existing understanding of the role of the alpha-2A receptors, which are prevalent throughout the prefrontal cortex. Stimulation of the postsynaptic alpha-2A receptors is thought to strengthen working memory, reduce susceptibility to distraction, improve attention regulation, improve behavioral inhibition, and enhance impulse control. The alpha-2A receptor can be stimulated through normal levels of the catecholamine norepinephrine. Norepinephrine has high affinity to the alpha-2A receptor. Increasing the levels of norepinephrine enhances the likelihood of engaging the alpha-2A receptor, closing the ion channel, and strengthening the network signal. However, ADHD patients may have low levels of norepinephrine. As a result, it is believed that the alpha-2A receptor is left unengaged and the strength of the signal is weakened. Intuniv is the first selective alpha-2A agonist believed to work independently of norepinephrine. Guanfacine, the active ingredient in Intuniv, has been shown to directly engage the alpha-2A receptor, close the ion channel, and increase the signal strength. Guanfacine is a selective alpha-2A receptor agonist in that it has a 15 to 20 times higher affinity for this receptor subtype than for the alpha-2B or alpha-2C subtypes. Although the mechanism of action is not known, our evolving understanding of this preclinical research regarding the alpha-2A receptor and guanfacine provides insight into the role Intuniv may play in ADHD.